on his plan to repeal and replace Obamacare during his address to Congress tonight. So joining us now is Texas Republican Congressman Michael Burgess. He's the longest-serving medical doctor in Congress, and he heads the subcommittee on health that is helping draft the new bill. Good morning, Congressman.
Good morning. Thanks for having me on.
Great to have you, because you are the perfect person for us to talk to, because you're right at the center of trying to craft what will be the replacement. So let me ask you where you are with all of this. As we understand it, there are 4 competing GOP bills making their rounds through the Capitol. Which one is going to win?
Well, if you take a step back and look at what the House and the Senate did in December of 2015, there was a bill passed under reconciliation instructions in 2015 that did repeal major portions of the Affordable Care Act, took taxes and mandates out, and was sent to President Obama. It was vetoed by President Obama. The Senate could not override the veto, and that's where it ended. But that was the basis, that was the starting point, and many of us made that point during the fall election, that the House and the Senate have already acted under reconciliation rules. We have showed you what we can do, what is within our power to do, and if we had a president who would sign the bill, now this becomes a different equation. So that day exists right now. The reconciliation bill that came through in December of last year, again, is the starting point. There is now an attempt to try to add some additional pieces to that, some insurance market reform, which I support. I think that's a good thing. Expanding health savings accounts, providing tax credits for people who need them to help them purchase insurance. But the basis is the reconciliation bill that already passed the House and the Senate in December of 2015.
And Congressman, just help us understand, if you do away with the individual mandate, how do you pay for it?
Well, actually, doing away with the individual mandate frees up a significant amount of cash under Congressional Budget Office rules, but I think that basically misses the point. Are people going to have coverage? And that is a significant issue that we all deal with. We don't want any reduction in coverage. We want people to have coverage. But, you know, the problem that we're into now, and the reason that we're even having this discussion, the Affordable Care Act in many ways is not working, or maybe it is working as intended, because people were looking to collapse the system and get a single payer system as a result. But the individual market is under significant strain right now. And when people talk about being worried about losing their insurance, if an insurance company actually goes away, that is the risk for losing insurance, and that's the risk that people face right now.
But Congressman, what about that coverage? What are you guaranteeing Americans who are listening? Will people, and do you know how many, lose their coverage?
I don't know that I have a figure for you on that, but I think coverage will be available and accessible and affordable. And remember, one of the big problems with the Affordable Care Act is stuff is not affordable. That doesn't mean it will be cheap, but it could be more affordable than it is today.
But some people will lose. I mean, I hear. Let me just clarify your language, because you say it will be available and accessible, but it sounds like under whatever plan you present, some of those 20 million people will lose their current coverage that they have.
Look, I have never thought the individual mandate was a good idea. I've been against the individual mandate since day one. And in my book, repealing the individual mandate is on an equal par with repealing the Affordable Care Act. I recognize that without the individual mandate, there are some people who will say, no, not me, I'm not going to do that. It is part of our job to make people understand, to help people understand how important, how responsible it is to have insurance. The problem has become things have gotten so expensive that people look at it and then just shrug their shoulders and walk away. And, you know, Bill Clinton, I think, said it best in October. You've got a crazy system where people are paying twice as much for half the care. That's a recipe for disaster. That's what needs to be fixed.
President Trump said last month, we're going to have insurance for everybody. There was a philosophy in some circles that if you can't pay for it, you don't get it. That's not going to happen with us.
And I support the president. I want everyone to have insurance.
Yes, but not everybody is going to have insurance.
I think everyone should have a policy that is accessible and affordable. Again, that doesn't mean cheap, but it does mean affordable within what the disposable income a family has to spend each month.
So then why don't you say that nobody's going to lose coverage? I mean, if you support the president that everybody should have coverage, and you think that it's possible that it can be affordable for everybody, why aren't you willing to say, yes, under my plan, everybody will have coverage?
Everyone have coverage available to them. I recognize that not everyone is not going to prevail upon the coverage that's available. And we learned that during the Part D of Medicare. Remember back in 2003, we were criticized for not making it mandatory that seniors have to buy a prescription drug benefit. We didn't want to make it mandatory because we thought there should be an element of free choice. What did we end up with? We ended up with 96% of seniors obtaining some type of prescription drug coverage, and 96% were satisfied with the coverage that they had.
Congressman, very quickly, what's the date that we'll see your plan?
You're going to see movement within the next couple of weeks as far as my subcommittee is concerned. As far as getting something through the Senate, that's a bigger guess, and I don't have an answer for you there. But we're very, very close to having something move through the full committee within the next couple of weeks.
Congressman Michael Burgess, thank you very much.